Well, hello everyone. Well, thanks for coming out tonight and talking a little bit about diabetes. Okay, a little bit about me. My name is Sam Anderson. I'm a practicing clinical endocrinologist. A little bit of background. I grew up down near Circleville, Ohio. Grew up on a 100-acre horse farm. Ended up going down to Cincinnati for a few years for medical school and pharmacy school. Then head out to Penn State for a few years for training. Then came back to Columbus. I was in Columbus for about 23 years practicing, and then moved up to Knox here about a few months ago. So I love being here. I love all my new patients that I've met so far. And again, tonight we're going to talk about diabetes, obviously. Not a whole lot about medications tonight. We're going to touch on like why we use them and how we use them a little bit. But we're going to focus a lot more on kind of the non-medication things to help deal with diabetes. So we'll talk a little bit about diabetes itself, some interventions we can do, and how we can kind of work together with everybody to kind of get diabetes under better control and to kind of decrease the kind of significant complications that can occur with diabetes. So let's get started. There'll be questions at the end, by the way, so if you have any questions, store them up. So what is diabetes? So pancreas produces something called insulin, right? So insulin is that hormone or peptide which helps keep our blood sugars under control. So with the problem with diabetes is the pancreas doesn't work so well. It starts to fail on us. In fact, by the time you're diagnosed with diabetes, you've lost about 80% of your pancreas function when it comes to insulin production. So when the pancreas starts to fall behind, the blood sugars start to increase. And that's a very, very simplified version of what happens in diabetes. It's a lot more complicated. And this is a very nerdy slide I could go into and talk for about 2 hours on, but it turns out that just about every system in the body is contributing to these high blood sugars. There's defects in the brain, in the gut, in the kidney, in the liver, all kinds of things, which makes our blood sugars go high. Okay? So you think, so how common is it? And we'll talk more about the diabetes in a minute. So I hate to use the word pandemic, but when you talk about diabetes, about 11% of the population has overt diabetes. Okay. When you add in those people who have pre-diabetes or have sugars, mild elevations in sugars, but not quite in the diabetes range, we're adding another 100 million people onto that number. So as you can see, there's probably no one in any room that doesn't have either a family member or a friend or a colleague that has diabetes. So the first thing I want to emphasize is if you have diabetes or a friend or a family member with diabetes, they're not alone. Probably every restaurant you go to, every event you go to, there's going to be people with diabetes in that room. And some people, I think, feel ostracized with the diabetes when they get diagnosed with the condition. Oh, now I don't want anybody to know I have diabetes. But you're not alone. There's lots of people around you that are dealing with the exact same thing. And so we're going to go over some ways to kind of help with that and try to decrease this number over time. We're actually starting to improve things across the population. With newer interventions, newer medications, we're starting to see this number level off actually. And we're starting to see a decrease in complications of diabetes over time. So it is working, but as you can see, it's a big problem for a lot of people. So it's all about sugar, right? So it's just a sugar problem. In fact, I get a lot of people come in and say, "Doc, I have a sugar problem." Well, kind of. What it's really about is inflammation. So when you have elevated sugars in your bloodstream, it's kind of like rubbing rough sandpaper on the inside of your arteries and blood vessels, right? Over time, as you keep rubbing that rough sandpaper over those blood vessels become inflamed. So what happens when blood vessels become inflamed? They start to form plaques, and those plaques start to shut down those blood vessels, and that's when we start to seeing the end results. The heart attacks, the strokes, the eye damage, the kidney damage, the nerve damage, the diabetes. So that sugar is a marker. And so we want to improve the blood sugars, But what we're really trying to do is to decrease our whole body inflammation. So there's a lot of different ways to do that, and we'll talk about some of those things. So again, as I said before, when blood vessels become inflamed, they become stiff. Again, that makes your blood pressure go up. Cholesterol starts to form plaques inside your arteries. That's where the heart attacks and the strokes come from. And then the blood vessels start to shut down. So you have the vision loss, the blindness, the kidney failure, damage to the nerves and amputations and those kind of things. So it's better to catch this stuff early and to treat that inflammation by various methods to decrease the endpoint. We actually want to, believe it or not, we want to try to keep you out of that big building across the street here. So how do we do it? Well, in general ways, obviously we want to decrease those things. We want to decrease the blood pressure. We want to decrease the cholesterol. We want to decrease the blood sugars. And there's various ways to do that, both with and without medications. So tonight we're going to talk mostly about non-medication ways to decrease our inflammation, our blood pressures. I will say one thing about medications. I have a lot of patients that come in and say to me, you know, my doctor just wants me to put me on pills. He wants me to be, or he or she wants me to be a guinea pig. I have a problem. They just put me on medication, diabetes included. So, in our defense, I want to let you know that we tried before to start without medications. If you look at the American Diabetes Association guidelines from about 30 years ago, you will see that they said, all those experts said, when you find somebody with diabetes, do 6 to 12 months of lifestyle therapy. Okay? And that was the national policy for decades. It unfortunately failed miserably. The rates of diabetes and diabetes complications skyrocketed during those years. Okay? Because across the population, there are exceptions, obviously, but lifestyle alone didn't seem to do much as far as preventing new cases and preventing complications. So that's why you'll see, if you ever are bored, if you ever want to sleep at night, just pull up the American Diabetes Association guidelines. You'll see all the recommendations in there. It'll say start medication right away. And that has actually been shown. Now that they've changed those guidelines, we're starting to see a drop-off in hospitalizations and death from diabetes. Okay? So don't be mad at your doctor if you or a family member or a friend or a colleague go in with their first visit for diabetes and automatically want to be put on some medication. Okay. So let's talk about lifestyle a little bit. Lifestyle is just as important, if not more important, than any medication we do use. And the reason that the lifestyle recommendations were placed there in the first place is if they're performed, they do work across the population. So it's not the funnest part of treating diabetes from a patient standpoint, but it is very important. So what does the American Diabetes Association say about exercise? Okay. So the ADA says the goal for exercise, and they suggest two forms of exercise. Aerobic or cardiovascular, that's your walking, bike riding, swimming, those kind of things. And resistance or weight training as well. Their goals are pretty high. 150 minutes a week. That's 30 minutes, 5 days a week of cardiovascular exercise. 2 to 3 sessions of weight lifting or resistance training a week. That's pretty hardcore, right? So that's a goal. Okay. If you've never done this, don't start off this way. You are going to end up in the hospital across the street. So some interesting data on that. They took a large study, this was done 30 years ago, a bunch of patients with pre-diabetes, high blood sugar, but not quite in the diabetes range. And this was their goal. This was their goal for the lifestyle group. In other words, they had 3 groups of people. One group they put on medication. One group they told them, do this. Okay? And the third group they said, just be healthy. Okay? At the end of a year, they brought everybody back. The people who did the best from a sugar and blood pressure standpoint were those who were told to do this. Okay? None of them reached that goal. None of them reached the goal. None of them got to 150 minutes a week, 2 to 3 sessions a week. But just by knowing that goal and working towards that goal, they were able to drop their blood sugars better than the medication alone group, because the medication group was told not to do any exercise, okay? So this looks daunting, right? But what I tell patients is I'm not so worried about the duration of the exercise during the day, it's the frequency of the exercise. So I'd much rather have somebody do 5 or 10 minutes every day than an hour once a week, okay? Then slowly work your way up from that low level up to a higher level as far as the exercise. It turns out it doesn't matter what it is, really, what type of exercise really, whatever you like to do. If it's walking, if it's as much just stretching exercises on a chair, if it's chair yoga, if it's marathon running, it doesn't matter. Just the fact that you get out there and do something that's not what I call the incidental exercise. There's 3 levels of exercise. There's the non-exercise, that's sitting on the couch watching TV, all right? I love that one. There's what I call incidental exercise, and that's the stuff that is good. You're active, you're cleaning the house, you're mowing the yard, you're going shopping. Those are all good, what I call incidental exercises. Much better metabolism burning than sitting down. But then there's the 3rd level, which is the one there where your only thought while you're doing this is about your health. In other words, you're not walking around shopping. You're not cleaning up the spill on the floor. You're only doing it because you want to get your heart going faster, your muscles burning, a little bit of sweat going on. That's been shown to be much more effective than the incidental exercises that we do around the house. Okay. So when I ask people, what are you doing for exercise? I get a lot of that. Oh, I do yard work and I do gardening and I clean up the house, and that's great. That is wonderful stuff, but not nearly as effective as if it's your main focus of the day, or the time. Okay. So diet. This is a big one. So I reviewed social media before I came in here, and there's at least 1,000 different diets that you can use to cure your diabetes. Did you know that? Yeah. So it's very confusing to patients and clinicians to kind of figure out what is the proper diet for somebody with diabetes. Because that's changed as well. I mean, even the American Diabetes Association recommendations have changed over the years. So if those nerds don't know what to do, what are we supposed to do as far as figuring out what to eat, right? So let's go back to our basics. Inflammation. Okay? I just said diabetes and a lot of other conditions are related to inflammation inside the blood vessels. So very basically, we want to eat more things which decrease our blood vessel inflammation. We want to eat less of the things which increase our inflammation. So what foods increase our inflammation? So processed carbohydrates, we all know this, right? Breads, pastas, pastries, baked goods, all those kind of wonderful things. Sugary drinks, doesn't matter whether carbonated or not. The more work the meat goes through to get to your plate, the more processed and the more inflammation it causes, okay? So if it's a cut of meat off the side of a cow, that's good, not in moderation. If it has to go through a grinder and a bunch of fillers and additives and preservatives, not so good. Okay. And then deep fried foods. So if we take a good food and we put it in the fryer with a coating of whatever on top of it, you've now turned it into something which causes inflammation rather than decreases it. And lastly, alcohol. Alcohol, even moderate amounts, unfortunately, increases the inflammation inside our blood vessels. So what are some things which decrease inflammation? So fruits, especially berries, avocados, nuts, especially almonds and tree nuts, they decrease inflammation. Olive oil, as opposed to some of the seed oils and other oils. Leafy greens, fatty fish, onions, garlic, peppers, mushrooms. Not on a pizza, by the way. 'Cause remember your friend, yeah. So, and then the broccoli, cauliflower, Brussels sprouts, the dark chocolate. Yeah, that's key, dark. You add a bunch of sugar and milk to it, then it takes it away.
That's all I eat.
That's right. So, is this not? I'm not saying that this is all you eat, right? This is not your dietary plan for the next. Nobody's going to survive on just this, right? But what we want to, and it's not that you can't eat any of this either. Okay, I'm not saying these are a never for you anymore. But what we want to do is educate ourselves is which of the foods in front of us are inflammatory, which are not, and which are neutral. Okay, so we want to limit these, add more of these, but you can still have some of this stuff as long as you do it in moderation. So doctors are not very good at dietary guidance. We're very good at saying, don't eat this, don't eat that, don't eat this, don't eat that, don't do this, don't do that. We're not very good at giving positive reinforcement of what we can do, some alternatives of what we can do. And so again, that's why we depend upon others to help us out, dietitians, diabetes educators, to help us kind of decide how we incorporate things into our own diet based on what we like individually, right? I can give you a list of things, of these things, but if you don't like them or if you have allergies to them, you're not going to eat them. But at least it gives you an idea of what's causing damage, right? Because these things, unfortunately, they do cause, and I eat some of these too. I'm a little hypocritical, I do. These cause it, but I know these cause inflammation in my blood vessels, so I'm taking a risk when I do all these, all right? But I try to incorporate more of these into my diet to have a decrease in inflammatory response, okay? So it's not all on, all off. Everything's a balance. So what are some other ways we can do to improve diabetes control without medications, right? So these are things that require no drugs, no injections, nothing like that. So one of the things is glucose monitoring. So either prescription, or now there's actually an over-the-counter one called Stelo, continuous glucose monitors. They're ones that you wear. They have a little sticky on the back of them. They usually wear on the back of your arm. And most of them go to an app on your phone nowadays. And it basically reads your blood sugars 24/7. And it's interesting because they've taken several studies now where they take diabetics that are on the same medications or no medications. Half of them use one of these things, half of them don't. At the end of about a year, you go back, the people who wear those every day had much better blood sugars than those who didn't wear them. And it wasn't a drug, it was just by glucose monitoring. So there's a lot of, why is that, right? Why is that? It's not a drug, why does it lower your blood sugar? Well, when they surveyed those patients after the study, number one, they felt much more in control of their diabetes. They felt better about their health in general. They had a better idea of what dietary things affected their blood sugars because they get immediate feedback. And it helped even with their diet control and weight. People who wore these things weighed less than the people who didn't. You can imagine, okay, you're going to go for that second spoonful of mashed potatoes, but it's going to show up on my phone. Okay. So that's one thing without drugs that you can do to help lower your blood sugar. Reading labels. Food companies are constantly trying to trick you into eating more. Constantly. I went to the airport because I was taking a trip, and I said, I want a little snack for the plane. These little trail mix. I like trail mix. There's some healthy stuff in there, some nuts and stuff. I'll just read the label here. And it said, 150 calories. I said, well, that's not bad, 150 calories. Fine print. Per serving, 6 servings per bag. And the bag was like this, okay? It'll tell you, so they'll tell you how many carbs there are. They'll tell you how many calories there are. They'll say it on the label, but you really have to read the fine print. Because like I said, they're trying to see what the serving size is because they're constantly trying to trick you into thinking it's healthier than it is. And in general, if something says it's low carb, it might be high fat or high salt. If it says it's low fat, it might be high carb or whatever. So you always read your labels. Meet with dietitians and diabetes educators. As I said, doctors aren't very good at this kind of stuff. I mean, we focus on medications, we ask about stuff, but as far as having a sit-down discussion about dietary habits, we don't do a very good job. We're honest with that, okay? I hate to give out sheets of handouts of meal plans because it's been shown again and again, those things don't really work very well long-term. It's much better to have a discussion live one-on-one with another person or with a group. Check your insurance. Many plans now are incorporating benefits to help maintain better glucose control by, I've had patients say that, they'll help with supplies, discounts on gym memberships, meeting with dietitians, those kind of things. But they won't a lot of times come out and tell you that. You have to call them and ask about what kind of health benefits do you have for lifestyle improvements for my diabetes. And so it's very individualized. Can't tell you which ones do what, but I have many patients that are getting some care outside of medications to help lower their blood sugars by doing that. Don't do this alone. The things that we talked about as far as improvements in diet and physical activity don't just apply to diabetic patients, okay? If people who don't have diabetes also incorporate a healthier lifestyle, a better diet, more physical activity, those kind of things, it also improves their health as well. So it has been shown again and again that if people are alone and they try to make the changes on their own, they don't do as well as if they do it with either a loved one, a friend, or a group. So it's better to make plans to go exercise with someone else. It's better to join a class that does exercise or something like that. It's better to go to the education class, meet some people there that might have the same kind of things that you're going through and kind of participate with that way. So don't feel like you're alone, right? Because I showed you the numbers, over 130 million people have glucose disorders in the United States. That's a good chunk of the adult population. So don't feel like you're out there all by yourself. This last one sounds stupid, but it works. They did a study where the only intervention they told people was you're not allowed to use a plate, I think it was over like this big. They'd make no dietary changes, no physical activity requirements. They said the only thing what you do is use a smaller plate. That's the only intervention in this study. And darn it, their blood sugars were better, their blood pressures were better, and their weight was down at the end of 6 months. They didn't believe it. They didn't believe the study. That's the stupid study. That can't be right. So they did it again. And guess they got the same exact result. So it sounds silly, but it really does help. And so it's one thing you can do, again, without drugs to kind of help bring the sugars down and have a healthier lifestyle. All right, guys. Well, thank you for your attention. Thank you for coming out tonight. I appreciate you being out here. I really appreciate it.